Fixing traumatic injuries to the skin and bones of the face and skull is difficult because of the many layers of different types of tissues involved. But now researchers from Penn State have repaired such defects in a rat model using bioprinting during surgery, and their work may lead to faster and better methods of healing skin and bones. The researchers say that dealing with composite defects, fixing hard and soft tissues at once, is difficult. And for the craniofacial area, the results have to be aesthetically pleasing. Currently, fixing a hole in the skull involving both bone and soft tissue requires using bone from another part of the patient's body or a cadaver. The bone must be covered by soft tissue with blood flow, also harvested from somewhere else, or the bone will die. Then surgeons need to repair the soft tissue and skin. The research team used exclusion bioprinting and droplet bioprinting of mixes of cells and carrier materials to print both bone and soft tissue. They report their results in the journal Advanced Functional Materials. The researchers attacked the problem of bone replacement first, beginning in the laboratory and moving to an animal model. They needed something that was printable and non-toxic and could repair a 5 mm hole in the skull. The hard tissue ink consisted of collagen, chitosan, nanohydroxypyridyl, and other compounds and mesenchymal stem cells, multipotent cells found in bone marrow that create bone cartilage and bone marrow fat. The hard tissue ink extrudes at room temperature but heats up to body temperature when applied. This creates physical cross-linkage of the collagen and other portions of the ink without any chemical changes or the necessity of a cross-linker additive. The researchers used droplet printing to create the soft tissue with thinner layers than the bone. They used collagen and fibrinogen in alternating layers with cross-linking and growth-enhancing compounds. Each layer of skin, including the epidermis and dermis, differs, so the bioprinted soft tissue layers differed in composition. Experiments repairing 6 mm holes in full thickness skin proved successful. Once the team understood skin and bones separately, they moved on to repairing both during the same surgical procedure. After careful imaging to determine the geometry of the defect, the researchers laid down the bone layer. They then deposited a barrier layer mimicking the periodicium, a heavily vascularized tissue layer that surrounds the bone on the skull. After laying down the barrier, the researchers printed the layers of dermis and then epidermis. The researchers say that it took less than 5 minutes for the bioprinter to lay down the bone layer and soft tissue. The researchers performed more than 50 defect closures and achieved 100% closure of soft tissue in 4 weeks. The closure rate for bone was 80% in 6 weeks, but the researcher noted that even with a harvested bone replacement, bone closure usually does not reach 100% in 6 weeks. According to the researcher, blood flow to the bone is especially important, and inclusion of vascularizing compounds is a next step. The researchers also want to translate this research to human applications.